Hello, everyone. Welcome to the first day of our virtual workshop on Pan-Canadian Health Information Exchange Standards, or HIE standards. My name's Linda Bird, and for those of you who don't know me, I'm an adjunct assistant professor here at the University of Victoria. I'm also an active health interoperability standards implementer and advocate, particularly in the areas of SNOMED CT and HL7 fire. I'm also the instructor of UVic's HIMP 537 course on Health Information Exchange Standards, which is hosting this 3-day workshop series. So welcome, everyone. Before we get started, let's begin with our territory acknowledgement. We would like to acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt and Wasanich peoples whose historical relationships with the land continue to this day. So as I said, today is the first day of our 3-day virtual workshop on Pan-Canadian Health Information Exchange Standards. The workshop runs today, tomorrow and Wednesday from 4 p.m. Pacific time. Now, for the first 2.5 hours, everyone's welcome to join us to listen to some of the great speakers from across Canada. And then from around 6:30, we'll say goodbye to most of you. And then in the last hour and a half, I'll be taking the students of HIMP 537 through a range of hands-on activities to consolidate what we've learnt for the day. And I'll tell you a bit more about today's topic shortly, but just looking ahead, tomorrow we'll be focusing on Canada Health Infoway standards, and we'll also be hearing more about the shared Pan-Canadian Interoperability Roadmap. And then on Wednesday, the topics will focus around HL7 fire, including the fire, the Canadian Fire Baseline, Core, and more, and fire questionnaires and maps. So if you're thinking to yourself, how do I get to join those hands-on activities at the end of the program to get a better understanding of those interoperability standards? You can do that by enrolling in the University of Victoria's Certificate in Health Terminology and Interoperability Standards program. This is a 1-year part-time program with 4 graduate level courses done weekly through online evening classes, plus this virtual workshop. This is the only terminology standards program in Canada that is accredited with CHIMA, the Canadian College of Health Information Management, to become a certified terminology standards specialist in Canada. So if you'd like to join, please register by June the 1st for the September 2024 intake. To find out more, you can scan the QR code if you're quick now, or visit uvic.ca HSD HIMP certificates for more information. So here's the agenda for today's workshop. There are 2 main focuses for today. The first is the standards from the Canadian Institute for Health Information, or CIHI, and the second focus is on social determinants of health and other disease risk factors. So let's get started. I'm very pleased to introduce our first speaker, Marie-Chantal Ethier from CIHI, who will be presenting on CIHI Standards 101, A Path to Interoperability. And just a brief intro to Marie-Chantal. She is a healthcare leader with over 15 years of experience in healthcare management, clinical research, and data management across the Ontario and Pan-Canadian public healthcare landscape. She holds a Master of Science in Health Research Methodology with a specialisation in clinical epidemiology. She's currently a program lead with CIHI's data standards team, where she's involved in the planning, coordination, integration, and enterprise alignment of data standards initiatives across CIHI. So thank you so much for joining us, Marie-Chantal. I will pass the floor over to you now. Thank you.
Great. Thank you very much, Dr. Bird, and it's a pleasure to be here today. I'll just be sharing my screen, so just give me one moment here while I toggle over to my slide deck. So as introduced, my name is Marie-Chantal. I'm a program lead with CIHI's data standards team. I'll be joined today by other CIHI colleagues, but I'll be kicking things off today. And before getting started, I also wanted to acknowledge the lands from which we are joining you today. So we find ourselves connecting remotely from across the nation. So CIHI would like to collectively acknowledge the lands we occupy, whether treaty or unceded. I'm I'm personally joining you today from Toronto, the traditional territories of the Wendat, the Anishinaabe Nation, the Haudenosaunee Confederacy, and the treaty lands and territory of the Mississaugas of the Credit, and recognize that this land is now the home of many diverse First Nations, Inuit, and Métis people. So the first part of my session today will focus on CIHI data standards, but before jumping in, I'll be providing you with a brief introduction to the Canadian Institute for Health Information, or CIHI for short, for those that may not be familiar with our organization, to help set the stage for the content that we will be sharing with you today. And at the end of my presentation, there'll be some time for questions as well. So CIHI is an independent, not-for-profit organization, and we provide essential information on Canada's health systems. CIHI was established in 1994 and works closely with federal, provincial, and territorial partners and stakeholders throughout Canada to gather and disseminate information to inform policy, care, research, leading to better and more equitable health outcomes for all Canadians. We are led by a 16-person board of directors with representation from across the country. We are funded by Health Canada and have negotiated agreements with provinces and territories as well. So our mandate is to deliver comparable and actionable information to accelerate improvements in healthcare, health system performance, and population health across the continuum of care. Our mandate demonstrates our commitment to our stakeholders and ensures that we will respond to their needs rapidly with innovative tools and approaches. Our values are inclusion, integrity, collaboration, excellence, and innovation, with inclusion being an updated value that has broadened the intent behind our previous value of respect. So we have 3 strategic goals as an organization. One is to build a comprehensive and integrated approach to Canada's health system data. So this is where most of our content today will be focused on. We also aim to expand offering of analytics, indicators, and tools to support health system decision-making, as well as improve health information users who are better equipped and able to do their jobs. So CIHI hosts extensive linkable pan-Canadian data across the healthcare continuum. We operate 28 data holdings with data on acute care, home care, long-term care, pharmaceuticals, health workforce, patient experience, and health spending, just to name a few. Our stakeholders then use a broad range of data, measurements, and standards together with our evidence-based reports and analysis in their decision-making processes. We protect the privacy of Canadians by ensuring the confidentiality and integrity of the healthcare information we provide. So the data hosted at CIHI comes from a number of sources. So that includes hospitals. So for example, information on hospital admission, emergency departments. So CIHI receives data directly from participating facilities. We receive data from clinicians, so from primary healthcare electronic medical records. We do hold some of that data. We receive data from regulatory authorities and professional associations. So for example, health workforce data is received from national professional societies and associations, as well as provincial and territorial regulatory bodies and governments. We also receive data from provinces and territories. For example, some will submit home care data. Other home care data might come from regional health authorities as well. Another example is residential facilities. So CIHI receives data from long-term care facilities directly. So a number of sources makes up the data that we hold. So collaboration, as I mentioned, is an important core value for CIHI, and we are continuously working on bringing the patient voice to more of our work. We are committed to involving patients as they share their expertise, their advice, and their journey in a way that's meaningful, purposeful, and authentic. So we engage patients in three ways, primarily through advisory groups. So this includes representation on various advisory committees to advise on product content, for example. We also engage through patient groups. So this could include focus groups or structured one-on-one interviews. We also do public consultations. So often these can be via third-party vendors, where we aim to seek qualitative feedback on a particular topic or area. So we involve patients due to the unique perspective that they bring. It's really important that we ensure that those with lived experience are being consulted appropriately in the work that we do. So typically, CIHI has engaged researchers, clinicians, and other subject matter experts on various advisory groups or working groups. But having patients now part of these types of discussions does bring in a unique experience, and we're finding that happening throughout more of the work that we're doing. We often say that patient context fills the gap between data points, so essentially the data that we don't have. So now moving on to the CIHI Standards 101 portion of the presentation for today. So in this part of the presentation, I will cover what are health data standards, what are the different types of health data standards, what's involved in the development, methodology, and life cycle of health data standards, what is interoperability, a word that is increasingly present in the world of data standards and the work that we do, and how do health data standards relate to it? And what are some of the barriers to standardizing health data in interoperability, and what does this mean for our work going forward? So to start, what are health data standards? So they are agreed upon and documented ways of defining health-related concepts and patient information. They are computable, understandable, replicable, reusable, and interoperable. They contain technical specifications or other precise criteria designed to be used consistently as a rule, guideline, or definition. So health data standards are needed for a broad range of needs across the healthcare system. So you need data standards to define data that's used by clinicians to run programs and provide clinical care. They're also needed by care organizations like hospitals to do quality improvement and resource allocation. You also need health data standards to define the data points that are necessary for doing health system planning. So this is largely the work that CIHI does. So we can then produce analysis based on that data to report on how well the health system is performing and allowing Canadian comparability. And lastly, you need standardized data and health data standards to inform on population and public health factors and how to advance that. So across these pillars, standards enable stakeholders to facilitate design of data collection tools. They ensure quality of data. They enable data linkage, as well as improve comparability between different sources of data over time. And ultimately, they also reduce costs because of the reduced redundancy. This happens by ensuring consistency in how data points are defined and making sure everyone understands the data in the same way. And as a result, we're able to obtain comparable, multi-sectorial, disaggregated performance indicators. We're also able to provide high quality and equitable care and ultimately improve patient experiences and outcomes. So now I'm going to cover the different types of health data standards. So first we have health data content standards, which are the data required to produce the information. So these are standards for clinical care and administrative data. So for example, standards related to define admission date, a diagnosis, standards for population data for socio-demographic indicators such as sex and gender, for population health, so standards for access to care, as well as a number of determinants of health or social determinants of health. Another type of health data standard are code systems, which are structured terms or codes that represent related concepts. So these include classification systems, reference terminologies, and value sets. Some examples include ICD-10-CA, CCI, and SNOMED CT-CA. We also have information standards, which are standards related to indicator and methodologies for reporting purposes. We also have data exchange standards, which are the standards and that include the requirements for how data will flow, and allows information to move around seamlessly between systems and devices. So this would include health level 7, V2, V3, CDA, FHIR, to name a few that are listed here. And then finally, we have privacy and security standards, which are really foundational to the other types of standards listed here, and are really there to ensure that we are protecting the collection, the use, and the disclosure of personal information and de-identified data. So just to summarize, data standards are agreed upon and documented ways of defining and structuring health concepts and information to facilitate the consistent collection, connection, and exchange of data. So data standards define what data to collect, how to represent what is collected through data formats, data types, and value sets, and how data can be encoded for transmission and exchange. A lack of common data standards prevents information sharing between health providers, labs, health facilities, pharmacies, healthcare organizations, and ministries. So there are many collaborators, not just across Canada, but also internationally. The data standard space is surprisingly large, and there are many players involved, as represented on the slide here. So CIHI plays a role in establishing data standards, and our role is broadening to support interoperability. CIHI collaborates with an organization called Canada Health Infoway to enable interoperability, and you will hear more about this later in our presentation. In terms of jurisdictions and regions, they may adopt standards based on pan-Canadian standards that have been established. We have also a number of vendors that consume data standards. We also have international bodies, and we work to ensure alignment where possible with international standards, and bringing the Canadian perspective to those standards, such as HL7 and ISO. So for example, CIHI is represented on the HL7 Council. So these collaborators have different roles to play, and so it's important that we're engaging broadly to ensure that all of these perspectives can be heard. So when it comes to developing health data standards, at CIHI, we follow a simple methodology, which involves 4 steps. So first, we identify the health system need, then we develop and implement, before being able to publish and supporting stakeholders through the intake of those standards. And through all of this, it's very important to ensure that we are engaging broadly and consulting at a pan-Canadian level. So I'll just go through each of these steps in a little bit more detail. So in the first step, it's important that we are identifying a system need. So this can happen through periodic evaluation and also continuously scanning for the needs. We know that there are some areas that are continuously evolving, such as the equity space, other areas such as COVID-19, where there was some rapid development of standards needed because of the pandemic. So we will, identify those needs, and once those are identified, then we can proceed to developing the standards in collaboration with key partners. And that can be based on input that we've received through consultation, things that we can hear at various working groups that we have, technical committees, and we'll continue to collaborate with those partners to essentially develop and implement the standard with defined core data elements, value sets, and code system. And the approach might vary a little bit based on the care setting or the standard being developed. So once a standard has been developed, we need to publish it, and that happens by developing some supporting documentation. So that could include a user manual, data dictionary, coding resources, and other job aids that will help the implementation and publication of that standard. And then we support the intake of those standards. So CIHI isn't necessarily in a position to enforce the implementation of standards, but we will undertake a number of activities to promote and support that uptake. We work, for example, closely with provinces and territories, as well as other health organizations and vendors to make sure that the standards are adopted properly and implemented. Part of that support would include things such as training, support for data submission, or conformance testing. There's also a need for an ongoing maintenance. So for example, if there are changes to the standards, those need to be conveyed as well. And as I've mentioned before, but can't emphasize enough, we need to make sure we are consulting with numerous stakeholders and partners throughout each of these stages to make sure that we can have successful implementation and uptake of these standards. So now that you know what data standards are, how to develop them, we will look at how this relates to interoperability. So interoperability refers to the basic ability of system and devices to exchange data and interpret that shared data. So for two systems to be interoperable, they need to be able to exchange data and subsequently present that data so that it can be understood by a user. And data standards are foundational if you want to be sure that the data can be understood by users. So interoperability is an important concept in healthcare because patient care is a continuum. So which means that patients will see more than one provider. They may return for multiple visits and be seen in different care settings. So it's really important that providers have an accurate picture of a patient's journey across the care continuum. So this requires unambiguous communication. In an ideal world, the information would follow the patient, would be available at the right time, at the right place, and to the right people. So as patients move through the healthcare system and their data essentially moves with them, the foundation of that data has to be data standards. So you can't have meaningful data movement without standards. Clinical and administrative health data standards establish the content and technical framework that enables thousands of healthcare providers to communicate and share information that is contextual and unambiguous in meaning. And Pan-Canadian standards, in their turn, support the safe and secure exchange of health information across the continuum of care. So there are a number of barriers when it comes to standardizing health data in interoperability. And I won't cover all of these in great detail with due to the interest of time, but we'll touch on some of the bigger barriers that we have faced and that we've heard from stakeholders. So at a jurisdictional level, we know that timing and ability to implement or adopt data standards may differ across jurisdictions due to a number of factors. So these are legislative, they could be existing legislative challenges, as well around the sharing of data, for example. From an infrastructure standpoint, we know that the digital infrastructure to collect information in a standardized way is not always in place. There's certainly a need for ongoing technology investments in this area. We've certainly come a long way in recent years to move away from paper-based systems. COVID has certainly helped move things along, in particular in the virtual care space, where people are also more likely to want to accelerate adoption of technology and standards shaped by the pandemic. Progress, and we can say, although progress has been made, there's still certainly more work to be done to complete the digitization of healthcare and the standardization of the underlying data within those digital health systems that would then enable data to be shared more seamlessly across systems. Standards have also been customized across time within different jurisdictions to meet specific information needs. So it means that, across different jurisdictions, you might have similar standards that have been implemented, but not all of Canada is necessarily on the same standard. So that can prove to be challenging, as you're trying to advance and have a pan-Canadian standard across the board. From a vendor's perspective, we've heard that there's also a lack of incentive for vendors to adopt and implement standards. In addition, some vendors have also communicated that there's a lack of demand for clients to implement certain standards. So ultimately, it might depend on the needs of particular clients. Specifically where Canada might deviate from an international standard or what the US is doing, since many vendors are US based, there isn't necessarily sufficient incentive to customize for a Canadian solution. Vendors have however, demonstrated an understanding of our Canadian needs and willingness to work with organizations such as ours and Infoway to make progress where it is possible. So just to insert a little bit of humor here, this is a quote that had been shared with us previously, where standards are like toothbrushes. Everyone wants one, but nobody wants to use anybody else's. So if everyone is using their own standard, doing their own thing, standards become somewhat useless. However, we've started to see this change through some of our initiatives in adoption of common data standards and terminologies, which brings us a lot of hope for the future of data and healthcare in Canada. So one way that we're tackling these challenges is by partnering with others such as Canada Health Infoway to help us achieve interoperability in Canada. Together, our organizations came up with a plan on how we would tackle this over the coming years. So some of the concepts of this plan are listed here, and my colleagues will cover some of these in more detail in the second part of today's session. My team at CIHI is involved in developing the data content standards, defining data points needed at the point of creation or collection in order for Infoway to then bring their expertise and build the exchange standards that would allow data to move seamlessly. So to summarize, standards are the foundation for high-performing, patient-centric connected health systems. Standards are also necessary for data sharing, so for clinical information to flow with the patient across settings for access both by patients and care providers. Data standards would then also ensure that we can do data linkage and compare data across a wide variety of sources to support performance, evaluation, research, innovation, improve the delivery of care, and leading to improved health system outcomes. The ability to share health information consistently and efficiently will also ensure we're meeting the quintuple aim for healthcare improvement. So this includes improving safety and quality, and in turn, improving health equity, strengthening care coordination, increasing efficiency, and then reducing cost, reducing clinician burden, and physician experience, or clinician experience, I should say. Um, Data standards will ultimately improve population health, enhance patient experience, and enable and support best practices. So this ends the first portion of today's presentation. I will pause in case there's any questions before moving on to the next speaker.